Welcome to Rehab Now with consultant physiatrist Dr. Paula Dawson, or rehabilitation medical doctor. And I'm your host, Alicia Taylor. Hi, Doc.
Hi, Alicia. How are you?
I am doing really well.
Good.
Yes, I'm great. Remember, you can check out our social media pages. On Instagram, it's Rehab Institute Caribbean, or Dr. Paula Dawson, or Alicia Taylor Music. And for Facebook, it's Rehabilitation Institute of the Caribbean. And our website is rehabcaribbean.com. So now today we're talking about dislocation of bone and fracture. Fracture and dislocation of bone. I'm wondering if they are the same thing. Can you have a fracture but not have a dislocation?
Oh, yes, you're asking me? Of course.
Yeah, no, I'm
Yes,
just,
ma'am, of course.
I'm just thinking about it because I don't.
You can definitely have a fracture
What
of a bone.
Okay. So first of all, what exactly is a fracture?
Okay, a fracture of a bone is...
You can have a fracture of something else?
You can actually.
That's what?
Yeah, you can.
How is that even a thing?
Interesting. You can fracture your teeth. You broke off a piece of your teeth.
Oh, sorry.
Or
right.
tooth, not teeth.
No, that makes sense. Oh, you know what I mean.
You can
Teeth, tooth.
break off a piece of
You
your
can break your teeth. You can fracture your teeth. Okay.
Yeah. Right. So you can actually...
Fracture of a bone.
A fracture of the bone where the bone breaks. And so a break in the bone, I don't know if you remember, we spoke some time ago about stress fracture and compression fracture. So we're kind of taking it to the next level now. This is where the bone outrightly breaks. So there's almost like there's a space between one piece of the bone and another piece of the bone. And it's interesting, you have different types of breaks.
Look at me writing. Do you have different types?
Let me make you ask me.
Yeah, so do you have different types of breaks? Like you have a certain degree.
Yes.
You know, like with your, never mind, me not remember the C9 or, you know, self-foolishness mental.
Oh, okay. Well, yes, you can actually have different types of fracture, different types of break. And it depends on how you're classifying it.
Like different levels?
Well, not different levels, but
that's what I wanted to know. If you have different levels of fracture.
Not necessarily, but you can have partial or complete. I think that's what you mean.
Yeah.
So you can have where only piece of the bone, meaning the fracture hasn't gone through the full diameter of the bone.
Okay.
So it's a partial fracture.
It not broke it fully in a half.
It not broke it fully in a half.
Okay.
Right? So it's just one side break and the other side is still intact. Because remember, you know, the bone is like most bones, not all, but most bones are like a cylinder where you have the bone marrow in the middle and then the hard bone on the outside.
I did not know that.
Yeah?
No.
You ever bite a chicken leg? I love chicken leg. And you know, chicken breast is my favorite part of the chicken, not
But
the
you're
leg.
always talking about chicken leg.
So you have two types of bone. You have the hard bone, the cortical bone, which is the shaft of the chicken, and then the top part of the bone. You ever know the top part of the chicken bone is softer?
Yes.
So you have the softer type of bone and then the hard part of the bone. And so when the cortical, the harder part of the bone breaks, different from the callus, which is the soft part, breaks, you can either go straight, like when you ever bite the chicken and bone and half the one side of the chicken bone break and the other side still attached, that's a partial fracture. Or if you break it completely that's a full fracture. Now the thing, go ahead.
I just wanted to know, you said the bone, it's a cylinder thing on the outside.
Most bones, not all of them, because the shoulder blade is not a cylindrical bone.
Most of the bones.
Right.
And then inside there's a bone marrow.
Yes.
So what is the marrow? Me always hear the marrow, but I don't know what the marrow means or what it is.
The marrow, the medulla, the inside of the bone.
Is it another bone but just softer?
It is a very vascular, full up of blood vessel. That is where you actually make your red blood cells.
Oh.
Yes, I'm glad you asked that.
That
That is where your body produces something called erythropoietin, which is a type of hormone. In fact, recently you heard on the news where somebody tested positive out of competition for erythropoietin. So this is well new in the news. I can mention Armstrong, the bicycle guy. He tested positive for EPO, erythropoietin. So your body produces its own erythropoietin, right? And so that goes to the bone marrow and stimulates the bone marrow to make all blood cells.
Okay.
Most of the blood cells. So you have red blood cell primarily and some white blood cells, right? You have different types of white blood cells. But the bone marrow is where you make your red blood cells. Isn't that interesting?
It really is interesting.
And so you can have diseases that affect the bone marrow where the bone marrow become plastic, or a hypoplastic where you just don't make your red blood cells and you become anemic. But we should probably talk about anemia. We're going
You
to talk about
said you
anemia.
wanted to talk about anemia, but we didn't do it.
Yes, because you have different types of anemia. You have iron deficiency anemia, B12 anemia, different causes of anemia, bone loss anemia, like people who have heavy periods, or you're losing blood from the gut, the colon. So
Anemia is blood. It has to do with blood. Blood and
count.
bone? Okay.
Blood count. When your blood count low, is anemia.
Okay, all right, that makes
Right.
sense.
What are we talking about again?
I have no idea. We're always
we're talking
doing
about the
this.
bone marrow.
Bone marrow, bone. Okay,
We're
great.
talking about the inside of the bone. So the bone can be fractured. Now, you can have a closed fracture. That's important now. So you have partial complete, where only a piece of the bone, one side of the bone is broken, but it's not a straight through and through fracture. Or it can be an open fracture where
You have closed and you have open.
closed, right? So closed where the skin is not broken. And you have broken fracture where the bone break and the bone stick out through the skin.
Oh,
Sorry to
that one,
yes.
isn't that like the worst type?
One of the worst type. You have different worst type, but that one is a bad type. So I don't know if you remember back in 1992. You probably don't remember during one of, I think it was Olympics in New York. Llewellyn Starks, I think his name was, doing the long jump. He hit the thing. He landed, and his tibia, which is one of his leg bone, actually broke, and it came through the skin. Right? But it happens a lot. It happens frequently. In 2020, there was another long jumper who was going to jump, and he ended up flat on his face. He was Thomas Vander Peterson or something.
Flat on his face.
Because he hit the board and he fractured his leg. So you can, but his was still inside. Well, it didn't come through the skin. I want to tell you a quick story. When I was a medical student, I never forget working at UWI at the emergency room, and we treat some patients, and we have some amazing doctors. And through my rotation through all the hospitals, I've learned and I've seen how they manage fractures throughout throughout Jamaica. And I remember when I mentioned this doctor, Derek McDowell. He's an orthopedic surgeon in St. Anne, and he was a resident at the time. And we had a patient come at one of the hospitals, and he had a complete fractured ankle. And like you could see the bone. And I remember we in the operating theatre and Dr. McDowell working fast and working hard. And that patient actually flew out and went overseas. And I did a rotation in Miami in the emergency room about a year after. I met the doctor who received that person. And he was like, you guys did such amazing job.
Wow.
The guy recovered and his foot was saved.
Oh, wow.
I don't think I ever told McDowell that story, though. You don't have to tell him. But, so fracture you can have the complete, the incomplete. You can have a green stick. You have a type of fracture called
complete and incomplete.
Complete, incomplete. You have a fracture called green stick. What do I mean by that? Or buckle fracture. So children usually get a green stick fracture.
Okay.
All right, this you're gonna like this. You
Tell me.
ever get a piece of stick yet and break it, a dry stick, and it just break?
Yeah, easy.
That's breaking a bone, right?
Yeah.
Get a green stick now and try break it.
A green stick.
A stick that is not dry.
Oh.
So what
The
happens?
hardest thing for break.
Right, but you will notice when it's bending the green stick might start buckle on one side, and then you start to changes in the stick. You know what I mean? Like you're bending the stick, you try to bend the stick. So that is actually what we call a green stick fracture. That is usually the type of fractures that children get, because their bones tend to, if they're young enough and the force is not strong enough, instead of breaking,
It bends?
It bends and then it buckles and you get
But
a buckle.
it's still very painful as a
Very
fracture.
It is a fracture.
Okay.
And you have to put it in a cast. This is not to say that children will not get a straight up fracture.
Okay.
They can get a straight up fracture, but they are the ones who will get the green stick fracture or the buckle fracture.
More than we. Oh,
Right,
okay.
and then you have fractures where you have it's a spiral fracture. You can have a fracture where you have many pieces. They call that comminuted, many pieces of fracture pieces. Right? And why am I mentioning this? That will determine how long it takes to heal or what treatment
What do you need to do?
Right. You have some fractures that are spiral down the bone. Those are kind of hard to treat. You understand? So you have different types of fracture. And don't forget the compression fracture that I mentioned before in the previous episode.
Squeeze the square shape or the triangle into a triangle.
Right. So the fracture kind of compresses down.
Osteoporotic.
Very good. When the bone density is thin, more likely for you to get a compression fracture.
Okay.
Right?
So how do you assess? How do you know? Separate and apart from the open fractures that you can see the bone sticking out.
Right.
What about the others? That is just what kind of symptoms the patients present with? How do you know that they have a fracture?
Well, the good thing is the bone is what keeps the architecture. So if you break your bone, you usually see a deformity.
Oh.
So you will if you if you break your hand, you're going to see the hand twist up. If you break your foot, the foot going to twist up. But sometimes you can break it and not see the deformity. So it is when you have a break and then you have a displacement or angulation, you start seeing deformity of the limb.
Explain.
Let me
that
explain.
now
All
when I
right,
look
so all right, so if you have a stick, right, and you break the stick, and you still keep the stick straight, there's
Yeah.
a break. Now, if you start bend the
Bend the-
stick
ah.
into like a triangle, that's now angulation.
Ah.
Now, if you break the stick and move the edges away from each other, that's a displacement. So the orthopedic surgeons in Jamaica, them awesome, they can actually fix the angulation or fix the displacement and allow you to come back to full recovery, right? Another fracture that I didn't mention
Tell me.
is something called an avulsion fracture.
Hey, I've heard that.
Avulsion. So an avulsion fracture is, I'm going to say it in Jamaica, where a piece of the bone pop off
Sorry,
where
it's
the
not funny.
tendon or the ligament has pulled off a piece of the bone where it's attached around, usually around a joint. What do I mean by that? For example, if you have a piece one of your tendon that is attached to the thumb and it makes the bend your thumb.
Yeah.
And for whatever reason, there's a pull on that flexion tendon, and the flexion tendon pulls the bone from a piece of bone from the main bone. So it usually occur more commonly in younger people where their bones. You see, sometimes we see it in sports, right? We can also see it you can see it on in the digits on your fingers, but there is one that you can actually see around your iliac crest, your hip or the pelvis, right? So we have a growth plate there, and one of the quads, not a muscle, the four quads, which are the thigh muscles, they insert right at the top of the pelvis at something called ASIS, anterior superior iliac.
The ASIS thing.
ASIS, anterior superior, right? And that is where you can pull off a piece of the bone, so you can get an avulsion fracture. So you have the close, and then you have the open. The open one is where you have bone coming out,
Sticking out.
right? And so you can have whether complete, or you can have where you have displaced or angulated or comminuted when you have whole heap of pieces, right?
Okay, good. Thank you so much, Doc.
Yes.
So that's okay. We're gonna have to take a break. So when we come back, we'll
Yes.
talk a little bit more about the actions taken in case of fracture.
Dislocation.
Jesus.
we got carried away with fracture.
When we get back, we will talk about dislocation. Stay with us.
Yes, ma'am.
Welcome back to Rehab Now. If you're just joining us, we're talking about fractures and dislocation. Doc and myself got so carried away with the fracture, we completely forgot about dislocation, right?
Yes.
So we're going to talk about dislocation.
So what is a dislocation? A dislocation is usually when the bone, you lose its normal positioning at a joint. For example, your shoulder, pull out a socket. That's a dislocation.
Yes, I've seen people do that. People do it though. Some people do it naturally, like them can just...
It's a party trick. Some people do it as a party trick. Yeah, party trick. Some people can dislocate their hip.
Is that good?
Not
Is
good.
that a good thing?
It's not good.
Right,
So
because I'm just like...
exactly. So
you
here's the thing. So dislocation of the joints, especially the shoulder and the hip, you can actually dislocate your elbow. Brian Lara dislocated his elbow sliding into the wicket some years ago, right? And so the shoulder structure is maintained by ligaments, right? And so when you have some people that have double joint,
Yes.
ligament laxity, where the ligaments are looser.
That's what it's called? Ligament laxity.
Ligament laxity.
Hear that, people? And a double joint.
Or you want add another word to it, Baton's ligament laxity. B-E-I-G-H-T. Baton's ligament laxity, right? So you can have ligament laxity. And so what will happen is you can have subluxation. So you have something called subluxation, and then dislocation. So subluxation is where your something pulls out of the socket, but it not pull all the way out. It halfway pull out. Why is it that talking in pattern it explains easy? So, all right, subluxation is where the joint is pulled out of the socket partially. There you go. Halfway pull out. And then complete dislocation is where it comes out completely. Okay. So some people have dislocation of the shoulder. A common way you can have dislocation of the shoulder is if you fall on your outstretched hand. Right? Oh. You fall and you break your fall, your shoulder can pull out of the socket. So that's shoulder dislocation. Another way I've seen it happen is back in the day, and even now when you're driving and you're holding on overhead, if you're in a bus or if you're in a truck and you hit a pothole again, that jerk can pull your shoulder out of the socket. So you can have dislocation. Now, sometimes with the dislocation, you can have fractures around the joint if it's violent enough. Right? You can fracture the cartilage. You ask me what else you can fracture. So the gristle, again, the chicken bone, which is the white thing over one part of the chicken leg. If that gristle, that white thing, you can actually crack that. You can actually have a fracture of that. Grizzle? You can break the gristle. Yeah, you can break the gristle. You can have cartilaginous injury. Break the gristle.
You can break the gristle. Yeah.
You can have cartilage, and in the shoulder it's called labrum, right? Which is a labrum, which is what kind of extends the capsule of the shoulder. But I have patients who have been able to dislocate their hip by themselves, especially with the ligament laxity. So they stand up and you go bloop, bloop. So they are able to do that. Usually they don't have any pain when they do that. But the most common cause of hip dislocation is a motor vehicle accident. What they call it dashboard injury. So you're sitting.
I've heard that.
You've heard of it. So you're sitting and there's a head-on collision or the car hits something and the dashboard comes onto your knee and the knee pushes back on your hip and then the hip joint pulls out a socket. That is extremely painful. And that can be also associated with fracture as well. But the thing though is, going back to the ligament laxity, people with ligament laxity or loose joints over time tend to get pain in their muscles. Why? Because the joints are not so stable because the ligaments are loose, so the muscles have to work overtime to keep them in place. So if they're carrying a heavy bag, if they don't pull up the shoulder with the shoulder muscles, the bag will pull out. Right. So they tend to have a lot of neck pain and knee pain because they have to always be stabilizing the knee and the different joints with their muscles. So they're using the tendon. So the ligament that creates the inherent stability is not there.
Okay, so you're saying it's obvious when I get a broken bone, when I get a fracture,
right?
And obviously it's like obvious if I get a dislocation because you can see the displacement. What happens in the case of either? What do I do when we get
God forbid.
What actions must be taken in case,
All right, so what actions must be taken? Something want double back, but something. I can't double back.
All right, double back. I always run ahead of myself.
Yeah, but that's because you're such a great host.
Bless you.
Yeah. Thank you for the blessing. So, the causes of fracture. What causes fracture?
You mean dislocation?
No. Back to fracture, yeah. Because we never said, we know that you can break it from a fall.
Yes.
You can break it from a motor vehicle accident. You can break it from a big blow. Somebody give you a hit, or like a big Jamaican, a big dirty lick. You get a. Did I just? Yeah. I'm so sorry. So very sorry. I'm a medical doctor.
She's not sorry.
So I am very sorry. So it can be sports. It can be motor vehicle accident. You can drop a big fall, a heavy blow.
Yes, a trauma.
I like that, but. Believe it or not, you can get a fracture of your bone from a gunshot wound. Yes, and so the bullet can hit the bone and make the bone go into fragments. So we see a lot of, and I'd love to know what the research would show if we look
Is
at...
that the avulsion fracture?
No. This is the
Okay.
gunshot wound, just the
but now-
bullet just going through the high velocity.
Yeah, but it make it go into pieces.
But that's the middle of the bone, where
Okay.
an avulsion is from a bone, usually at the joint, because
okay.
that's where the tendon or the
got it.
ligament
Got
is
it.
attached.
Okay.
Right, and so it's interesting. So countries that are at war will have a lot of gunshot wound, but will have a lot of fracture as well. And so it's interesting. I'd be very interested to know what our incident is with fracture from gunshot wound, right? And so, and that would determine some of the treatments that we see. So these are some of the causes. In addition to that, thin bone. If you're bone thin,
Osteoporosis and
and osteopenia.
Yeah.
But some people may have bone tumors in their bone. Bone cysts. What is a bone cyst? A cyst is just a space, and sometimes the bone can just get thin for whatever reason. You have different types of medical pathologies that can cause a cyst in the bone. So you can get tumors, infection in the bone can cause a fracture. It weakens the bone, right? As well.
And any little thing that you do can cause the fracture if it's weak.
I'm glad you say that, right? Because there are some diseases that if you have this lytic lesion where it thins the bone, a cough can break your bone. But you would have had to have the predisposing thing. Malignant melanoma. There's something called malignant melanoma where you have lytic lesion, where you have these thinning pockets in the bone. You look in the skull, you see these thinning pockets on the skull, on the ribs. You can fracture your ribs, and you can. Yeah, I'm just writing up a paper. I'm writing up a paper called a cough-induced fracture, rib fracture. So you can cough so much from a bout of cough. You know somebody who have that?
No, man. It's just that sometimes when you're coughing so hard,
Right.
it feels
Right.
as if something a break for sure.
Right.
It feels very painful.
Right. So you can have a cough-induced rib fracture, usually more common in women, but it has to be when you're coughing persistently for a very
long time.
There's something called osteogenesis imperfecta. I want to mention that. Osteogenesis, OI, where it is a congenital medical condition where your bone is naturally thinner than normal. And you have different types of osteogenesis imperfecta. You have the ones that are very severe. They usually die very young because all the bones break up. They just break up. And then you have different types depending on how thin or how weak the bone is. And patients that have osteogenesis imperfecta are prone to having fractured bones quite easily. That are less impact or less trauma can fracture their bones.
Terrible.
Yes. And another risk factor is aging too.
Okay.
Have you ever fractured a bone?
Never in my life.
Praise the Lord.
And thank God. And I never will.
You have. Right.
I've had sprains and but nothing like that.
Right. And so with the fracture and the dislocation, which is why we'll put them together, even though they're two different things, right? There are problems with the bone. The thing with dislocation, you can hear what the patients might complain of instability in the joint, popping, snapping, swelling, redness. These are some of the things that you will see
Okay.
in a dislocation.
Great. Thank you for that. Now we're going to have to move to what happens when I get the fracture.
Right.
And then, the treatment. Because we have a little bit of time left.
All right. So when you get the fracture, you're going to be in a lot of pain. You may have deformity. You can't weight bear if it's one of your lower limb. If it's your upper limb, you can't use the hand.
Okay.
You can fall on your outstretched hand. You can fracture your wrist. You can fracture the arm bone. So people will usually ask that you keep it in an immobilized position. Try not to move it. Try not to twist it up. Kind of splint it if you can. Get a piece of stick or cardboard. You come into the hospital or to your primary, usually an orthopedic surgeon. The orthopedic surgeon is the person who's supposed to treat fractures, right? And then they'll do some x-rays to determine what kind of fracture you have. And then the orthopedic surgeon, I'm not an orthopedic surgeon, but we have some amazing orthopedic surgeons at UWI. You know, I always have a big up UWI. But UWI has trained people all over Jamaica, Cornwall Regional, St. Anne's Bay, Mandeville. We have some great orthopedic surgeons there as well. And then they may decide, do they cast it? We'll put on plaster Paris, or which is a white something that you see. But them have some new one now, which is fiberglass. glass, which is nicer. It's not as whitey and mess up your space. And then they may use the ones that you can remove, which is the big black boots that you see sometimes, right? Now, depending on the fracture, you may need to fix it. So the orthosurgeons are the amazing ones. So they may go in and do open reduction where they have to cut your skin, reduce the fracture, and fix it. Open reduction, internal fixation.
That's surgery?
That is surgery. And so they go in, they open the skin, they go down to the bone, and they fix it. Whatever they use, either nails and screws and plates. I mean, I have seen some amazing surgery done with people with fractures. So Jamaica boss, my father at almost 90 years old broke his hip. And Orville Samuels and Andrew Amorelli fixed him. And my dad was able to stand up, and he's almost 80 at the time, stand up in 3 days.
Wow, 3 days.
Yes, full weight bearing.
So
right?
with a fracture, it's always a surgery that needs to be done.
Not all the time. So sometimes you can just cast. Sometimes you break
sometimes you can just cast.
cast.
Okay.
So you leave it in the cast for a minimum of 6 weeks, and then you may do a repeat x-rays.
Okay.
X-ray, because sometimes the fracture might not unionize. And that's a complication. You may get non-union, malunion, where the two ends of the bone don't meet back. Or if it meet back and it twists up. Why am I talking in patois?
That's great.
If it meets, it's you have malunion, right? And there's some fixation that the doctors may have to do where you can open reduction but external fixation. You ever see somebody that with some metal wires on the outside of their leg? That's external fixation, right?
External fixation.
That's another.
Thank you for the terminology. Thank you. That's really all we have time for.
Really?
Thank you,
and
pretty.
I was just getting excited.
I'm so sorry. Time's up.
Oh boy.
We're going to probably have to continue another day,
We'll bring an
another
orthopedic
week.
surgeon in.
That's what we're going to do. But thank you to the producers, our
Yes.
engineer. Thank you to our sponsors, Rehabilitation Institute of the Caribbean, providing medical care for function and performance in association with Winchester MRI, Jamaica's first choice for MR imaging. Denk Pharma, a combination of key active ingredients designed to boost the body's natural defense. And of course, Almighty Studios, a recording studio where we create worship music to praise, to worship, and to serve. I will see you all next week, same time, same place. Blessings.
Blessings. Bye.
Almighty Studios, a place to record and rehearse in first-class style, a place you will want to have your work showcased. Welcome to Almighty Studios, a place for you. At Almighty Studios, we're here to praise, to worship, and to serve, exalting the King of Kings in worship music, where vocalists, musicians, and producers are inspired. Our engineers have over 20 years of collective experience in the music industry and are skilled in the art of mixing and mastering. Contact us by calling or sending us a WhatsApp at 876-770-6282 or email us at admin@almightystudios.com. Follow us on Instagram, Almighty Studios.